The United Kingdom is known for its advanced healthcare system and the National Health Service, or NHS. But behind the headlines and statistics, millions of people across the UK face serious health problems every single day. From chronic diseases to mental health struggles, the picture of public health in the UK is far more complex than it appears. In this video, we explore the major health problems that people in the UK are facing, and how these challenges are shaping the nation's future. Chronic diseases such as diabetes, asthma, and heart disease are among the leading causes of illness and death in the UK. Many people live with these conditions for years, often struggling to manage symptoms, medications, and appointments. The fast-paced modern lifestyle, poor diet, and lack of physical activity have all contributed to this growing problem. The NHS continues to provide support, but waiting times and staff shortages make it harder for patients to get the help they need on time. Heart disease remains one of the biggest threats to public health in the UK. Thousands of people die each year due to heart attacks and strokes, many of which could have been prevented with early lifestyle changes. High cholesterol, smoking, obesity, and stress are the most common causes. Despite campaigns promoting healthy living, heart disease continues to affect men and women of all ages, especially those over 50. Obesity has become one of the most alarming health problems in the UK. Many adults and even children are now overweight, leading to serious complications like diabetes, heart problems, and joint pain. Fast food culture, processed meals, and a lack of physical activity have made this worse. The UK government has introduced policies to reduce sugar intake and promote exercise, but changing habits remains a big challenge for millions. In recent years, mental health problems have increased sharply across the UK. Anxiety, depression, and loneliness are now as serious as physical diseases. Many people, especially young adults, struggle to find help due to long waiting lists and limited mental health services. The pressure of modern life, social media, and economic worries have added to the problem. The good news is that awareness around mental health is growing, and more people are speaking up. Breathing problems such as asthma and chronic obstructive pulmonary disease, or COPD, affect millions of people in the UK. Pollution, smoking, and damp housing are major causes. Many elderly people struggle to breathe properly, especially during the cold winter months. Even with inhalers and regular checkups, managing these diseases is a daily challenge. Clean air campaigns and anti-smoking policies are helping, but progress is slow. The UK has an aging population, and with age comes new health challenges. Older adults often suffer from arthritis, weak bones, poor vision, and heart issues. Many live alone, depending on carers or community services. Loneliness itself has become a serious health issue. Although the NHS offers free healthcare, long waiting times and lack of home support leave many elderly people struggling silently. Not everyone in the UK has equal access to good health. Poorer communities face higher rates of illness and shorter life expectancy. People in low-income areas are more likely to smoke, eat unhealthy food, and live in poor housing conditions. This gap between rich and poor health outcomes is growing, showing that healthcare alone cannot fix social problems. Tackling poverty is essential to improving the nation's health. Dental care is another major issue in the UK. Many people can't find an NHS dentist, or they face high private fees. As a result, thousands live with tooth pain, gum disease, and missing teeth. Poor oral health affects confidence, nutrition, and even heart health. Dental charities are now stepping in to help, but the system still needs serious improvement. Cancer remains one of the most feared diseases in the UK. Early detection can save lives, but many people wait months for tests or treatment. The pandemic made this worse, delaying thousands of cancer screenings. Breast, lung, and prostate cancers are among the most common. Awareness campaigns encourage regular checkups, but faster diagnosis and treatment remain critical for survival. The National Health Service is the pride of the UK, but it is under immense pressure. Staff shortages, limited funding, and long waiting lists have made it difficult for patients to get care quickly. Doctors and nurses are working tirelessly, yet burnout is common. Many experts warn that without reform and proper investment, the NHS may not be able to meet future demands. Prescription drug dependency and alcohol addiction are growing problems. Many people rely on painkillers or antidepressants for years. Alcohol misuse leads to liver disease and family problems. The UK government is investing in addiction recovery programs, but stigma and lack of awareness stop many from seeking help. A balanced approach, treatment, counseling, and community support is essential. Conditions like Alzheimer's and Parkinson's are increasing as the population ages. These diseases not only affect memory and movement but also place emotional and financial stress on families. Research is ongoing, but cures remain limited. Support groups and early diagnosis can make life easier, yet many patients still go unnoticed in the early stages. The environment plays a big role in public health. Air pollution, poor diets, lack of exercise, and high stress all contribute to sickness. Urban life is convenient but often unhealthy. Encouraging people to walk, eat fresh food, and spend time outdoors can transform health outcomes. Personal responsibility and public policies must work hand in hand to create a healthier UK. The health problems faced by people in the UK are serious but not hopeless. With stronger healthcare policies, better awareness, and community support, millions of lives can improve. Every citizen has a role to play by staying active, eating healthy, and caring for mental well-being. The road to a healthier UK starts with small steps taken every day.